Good evening, ladies and gentlemen. I welcome you on Motivational Monday on VOH Network. Myself, Dr. B.K. Rana, today's host for Motivational Monday on VOH Network. I am the director of Quality and Accreditation Institute, QAI, and a former director of NABH Quality Council of India. I'm also a international expert for WHO, World Bank, Asian Development Bank, United Nations Framework Convention on Climate Change, and USAID and ISCOA expert. With this today's Motivational Monday, we have with us Dr. Shubnum Singh. Dr. Shubnum Singh, we are fortunate to have you with us today on Motivational Monday on VOH Network. Dr. Shubnum Singh is advisor, CII, National Healthcare Council, Governing Board Member, Health Sector Skill Council, Governing Board Member, Life Sciences Sector Skill Council, and Consultant Emeritus, Max Healthcare Institute Limited. Today, we are going to talk about effect of COVID on healthcare talent strategy. Should be at emergency readiness to resumes. It's a very interesting topic in a difficult time of COVID-19, where all people around the globe have suffered. And we are looking forward to some opportunities to discuss and talk about some strategies to come out with difficult situations. Today, we are going to talk about some innovative policies, changes, breakthroughs, some potential challenges which we are all facing, what we have achieved in last couple of months of this difficult time, what we achieved in terms of new milestones in healthcare sector. We will be having a free chat with Dr. Shubnum Singh today, and I'm sure the viewers are eager to listen to Dr. Shubnum Singh on her opinion and points, what we are going to discuss today. So Dr. Shubnum Singh, it's really a great pleasure for me to welcome you on Motivational Monday on VOH Network. Welcome, ma'am, once again. Thank you very much for being with us today. And before I start with some questions, I would request that why don't you start sharing a word about yourself, please. Over to you, ma'am.
So thank you, Voice of Health, for giving me this opportunity. And to have somebody like Dr. Rana interact and question me, I think it's a great privilege. And I've known him for many, many years, very clear in his thinking and outcome-based, which is something that I really admire. These are and have been and will continue to be very difficult times, challenging times for each one of us, whether you're in the health sector or whether you're not in the health sector. I think it is a uniquely placed individual response to a circumstance which nobody in their wildest dreams would have ever imagined that in their lifetime they would have to manage this. So if I were to take the opportunity to share some personal thoughts, I believe for every human being, we tend to live our lives either in the past or in the future. And we never actually savor today. And this pandemic or this particular situation that we are currently in has brought to the forefront that our main business is to see what is here and now and not dimly at a distance. So it's here and now, and everything resides in each one of us to be able to tackle this challenge. The second thing I would like to share with everybody is that our training and our mindset in healthcare is that we are trained to multitask. And in this world of multitasking, we are, and it's contrarian actually, that on one side we say we need to multitask, but at the end of the day, the father of medicine, Dr. William Osler, said, live life in day tight compartments. If you don't live life in day tight compartments, then you lose focus. And in this current situation where you're trying to be everything to your patient, everything to the patient's family, the tendency not to focus is extremely detrimental. That's point one that I'd like to share with everybody. The second point I'd like to share is that the concept of rest is alien, right? Rest does not mean that you pluck yourself away and you need to go and lie down for 15, 20 minutes. No, resting in between, even just closing your eyes for 15 seconds or 20 seconds actually reboots you. The third bit that I'd like to share with everybody and then I'll hand it over to Dr. Rana, is that the concept of cooperation, right? The concept of cooperation means that as individuals, you must learn to delegate. You can't take on everything and everybody. Again, I would put it down to our training that says, no, I have to solve for this problem and I will tell everybody everything is going to okay. No, you can't. You cannot be everything to everybody. So you must be true first to yourself and then extend that confidence that you have in yourself to the others to be able to pull you through this extremely difficult time. Lastly, we think a lot. I am this. I am the ward sister. I'm in charge of everything. I am the treating doctor. Don't question me. I am the manager. I know how to manage which patient needs to go X, Y, Z into the ward, into the ICU, etc. That's a good thing. That's a good thing that the responsibility is taken up. But underlying this, in every individual, there is a level of uncertainty and fearfulness about who they are, right, as people. Please remember, you are what you think you are. The emphasis is on the word think, and this is not as of today. It's as old as 18 centuries ago when Martin Alexis turned around and said, our life is what we make our thoughts. So when I think of something, that's what my life is going to become. So if you think you will not be able to get out of this difficult situation, you will never be able to get out of it. So if people start thinking that, yes, I will get out of this, then you will get out of it. So thoughts are extremely, extremely important, especially currently in what we are going. Over to you, Dr. Rana.
Garrett, thank you so much, Dr. Shubnum, for very insightful personal experience, views, expressions. I don't have words to express the thought which I got from you in this difficult time. I think very well said that if we start practicing these moments, and these experiences with our life, I think things can be made easy, even in the difficult time like COVID-19. And this is not specific to any individual, is all over the world. So I think we have to come together and think in a very positive manner, like you very aptly mentioned, to move forward. Life has to go on. We can't be waiting for something to happen that things will improve and we start walking, but we have to keep going. So thank you so much for very insightful expressions and views. So now I will actually move on to the topic questions. I know you for last several years you have been in different positions, uh, very able leadership. You have drawn this organization to different level. So let me just start focusing on the topic which we are going to discuss today. What, according to you, is the real-time scenario of the healthcare talent strategy? We are talking about, do we need a change in talent strategy in healthcare? How far do you think this COVID-19 has affected all of it? Over to you.
So it's a very very interesting place. So at one level, the reverence paid to the health worker is enormous, And on the other side is the fact that actually nobody can pay for the services of the healthcare personnel to commensurate the individual's needs. So this is a huge problem that we are going to be facing at this moment. That's point number one. Point number two, regulations have not exactly spoken to the problem statement for years on end, right? And there's a constant flip-flop. I'll give you an example of the flip-flop. So the restructured Medical Council of India said that there will be no more diplomas. There'll only be the basic courses, MD, DNB, etc. Then when the crisis hit midway after announcing this, they said, no, DNB will now do 2-year diploma courses. So today, the situation is that if we don't wake up as healthcare professionals and push for certain changes by which people who are actually on the ground, who are competent, who have years of experience in various fields, they do not get accepted under the basis of what we call recognition of prior learning, very much like what you have in England, right? And other countries, that when you want to do a post-graduation, you go and you work under somebody for 4 or 5 years, and then you take an exit exam. So that kind of strategy is what is needed today. If we do not have that, then this gap, which is yawning for years on end, is just going to make the entire system collapse. Now, if you look at a hospital, 54% of whatever you spend in a hospital goes to manpower. But if you do not have that manpower, what do you spend? And that begs the question, how can you have a hospital without people? So it's like a never-ending cycle, which the entire fulcrum of healthcare is on people management, on people.
So it's about what you want to say is about change. You need to change as per the situation.
Yes.
Otherwise change will change you. You know.
You've been pushed. You're so right. So if you take, for instance, what I mentioned, that earlier they did not, they removed the diplomas and then they reintroduced it. You get my point? And the reality also must be understood that in tier 2, tier 3 and last mile connectivity, you simply don't have people. You don't have people. So is it the fact that no healthcare is being delivered? Absolutely not. Healthcare is being delivered. So it's better.
I think you are absolutely right. I think we need to see what is the prevailing situation and what is required in this need of hour, and accordingly work out the strategy. Otherwise, it's going to be difficult for everyone. And as you know, everybody says the healthcare is a very sophisticated subject, and because it's directly deal with the life of people. And as I can see,
sorry to interrupt, Rana. I'll give another example of change. Now, in Rajasthan, for instance, when this happened, right, all the people who were on contracts, overnight their contracts were renewed.
True.
Now, why does it have to wait for something like that to make it happen?
You have the resources, but you are not making use of that resources.
Yeah. Absolutely.
So I think that's take us to the next questions in healthcare, and with your immense experience in the field of managing institutions and administration of healthcare setups at different locations and different roles, what do you feel that the uncertainty and which the COVID-19 has created might affect the healthcare delivery in time to come?
So my biggest fear is that, youngsters will not find it attractive to get into the health sector. That's my biggest fear. As it
Okay.
is, as it is over a long period of time, the number of people applying for the open entrance exams had started dwindling, right? And this fear factor that has kind of set in into the healthcare environment is honestly very fearful. I'll give an example. Yesterday, I was on on a webinar in which we were discussing exactly this, and they said that out of a group of 25 doctors, GPs, 24 have said we are not going to practice. You see,
Oh,
so when this kind of thing happens, that on one side the existential people say, I'm not going to take care of people, my life is more important. You cannot blame and fault them for that. And on the other side, the pipeline also gets cut off, right? Then when that
yeah.
pipeline gets cut off, you are in for trouble.
True. I think absolutely, absolutely, and there is no second thought on that. We need to be prepared as well, you know. And as you know, this epidemics, pandemics, they are, you know, the public health emergencies. And in case of any public health emergencies, the role of government is very critical because this COVID-19, you know, the SARS-CoV-2 is a pandemic declared, and so it's a public health emergency for each and every government in the states around the world. So, what is your opinion in terms of how this public health, you know, issue or pandemic-like situation of COVID-19 should be dealt with? How it affects actually the entire healthcare industry?
So, one of the biggest realizations that we have to come and accept is that public health belongs to individuals. It's not purely the responsibility of the healthcare personnel or the healthcare industry. And here is where I would say that from February onwards, I have seen a dramatic change in other industries coming forward, understanding that health is not just the purview or the responsibility either of the government or the healthcare industry, but industries also need to take care of the health of their employees, right? And
True.
so I would say that paradigm shift has started, Rana, which is very, very important,
Very
right?
nice. Yeah.
And the second very important bit is that uh, healthcare and education have become the number one and two agendas, give or take. Somebody takes education first, somebody takes healthcare first,
Healthcare.
second, vice versa. It's become an agenda for them to utilize their CSR money, to utilize their talent pool, which is very important. And that talent pool utilization was very beautifully exemplified when they came forward, and from a net importer of PPEs, we've become an exporter of PPEs, and likewise for
True.
uh, ventilators, right? So that change in public policy and public health is taking place. So the ownership now, if I were to summarize it, would be a shared responsibility between the healthcare industry and other people, you know?
I
So
think I
that,
think
that
yes.
paradigm shift is taking place.
Fantastic. I think I take the two keywords from your conversation. The first is public health, you know, is not the responsibility of the government or the healthcare institution, but it's everyone's responsibility. Every one of us has to take on us that this is what we need to do, and we have to support the government and the facilities. And second keyword, I take it the share responsibilities. That is again is we have to work together. We have to share, you know, responsibilities not only in terms of what we need, but also what we can give to others, how we can support others in this difficult time in whatever means, ways, and methods we can. So I think this is how it is happening around the world, and we have been hearing the stories, the real stories from different countries, how badly the countries have affected, you know, and many patients have already lost their lives. But again, the healthcare systems who were sustainable in terms of supporting each other and supporting and, you know, relying on the system what they already have, they were successfully, you know, could fight with this COVID-19, and they are continuing with their journey. So I think this is very important for all of us to take from you is that individual's responsibility as well as sharing the responsibilities. And one funny thing comes to my mind, and I'll keep saying, and I think everyone does, when we say the responsibility of individuals, we are supposed to wear masks, right? At least where we are going out or public places or in crowded places. But unfortunately, it's taking the same model like helmet does. Helmet has shifted from head to elbow. Similarly, the mask has been shifted from nose and mouth to the chin. So this is, and I ask questions from several and say, why? Oh, I don't have corona. मुझे नहीं होगा. So I think these are the things which are definitely a lack in our mindset, that these are our responsibility not only to protect ourselves but to protect others as well. So I think thank you so much, Dr. Shabnam, for these wonderful insights. And now I'll go to a different stream of questioning, and I will come to a very specific question. Now, you have been into healthcare for several years in different positions. So what has been your mantra for life that helped you build into the person that you are today?
So my mantra for life has been you have to be passionate of what you're doing. So unless you are passionate, you will never enjoy your workspace, right? So
Yeah.
if you get into a job and you feel, this is not what I wanted in life, but you don't have an option, my advice to you would be love it. Okay, love it, and you will see the change by which you will be able to uh, demonstrate and change things, right? Then the other mantra that I have is that if I can't change something or somebody, I have to learn to accept it, right? And then if I'm headlong in wanting to change it, I must have the courage, right? Not only
Yeah.
must I have the courage, but I must have all available data in this data driven world, or I must have evidence that this change is going to be good. And I have the courage to accept that if it does not happen and it's a loss, I'm ready to take that responsibility, right?
Yeah.
Uh, the third mantra is that there's perfection is never there, Rana. Perfection is
True.
never there in anybody, including yourself. So the first thing, and that I think is the most difficult, is to look within yourself and say, okay, I'm good at this, I'm not good at this. So if I'm not good at this, I will reach out to somebody to help me. So don't expect perfection from others when you yourself are not perfect.
True.
And there's good in everybody. There's good in everybody. So learn to work with the good and grow on it. And the last one, which I firmly believe, is that if there's a huge boulder in the middle of a road, don't try and उसे टक्कर मत लगाओ. कोई फायदा नहीं है. चोट तुम्हें को पड़ेगी. Right?
Don't go the way you are not supposed to go, right?
So when you have that boulder, look at alternative things, be kinder on yourself and others. So I think that's about the little, and I don't live in the past at all, Rana.
No, I think
I'm not
that
lives in
that's
the
very good.
past.
That's so candid of you, sharing this thing. And I think uh, very insightful, I would say. Don't hit the wall necessarily when you will get hurt. The wall will not. So I think move
Yeah,
on with those people, those minds, those ideas which are supporting to your ideals, and what can contribute to your development, contribute to the development of others. And again, I can link it with share responsibilities. you know
absolutely.
we need to think of a whole ecosystem when we talk about the development of a community. And as an individual, we definitely contribute a lot. And in an emergency like COVID-19 is actually has taught us so many lessons, how we can work together and how we can support each other, which is the only key to success. Dr. Sabnam, at times people say that to become a successful person, or even in other ways, that everyone has some idol, or some leader whom they look up to. Is there any person or a leader in your life who have actually you even today you look up to?
So I'll share something that my father told me, and that was, he said, you have to be yourself in life. Hmm? So constantly learn, constantly educate yourself, but never imitate anybody, right? Because if you do not believe in yourself and you don't grow, so if you ask me, is there a one role model? I have several, and I do love reading. And non-medical also, it's like a 60-40 ratio. So I have read the lives of so many people, and I find that there is leadership, there is much to learn from everybody who crosses your path. So to me, there is no one mentor, one person, but there are many mentors and many people from who I would like to be. So I'd like to be a little bit of this from somebody, a little bit of that from somebody, and not imitate anybody.
Thank you
I
so
hope
much,
that.
Dr. Sharma. I think yes, that's brilliant, and I think that's fair enough. It's not necessary that you have only one person who can, be an inspiration for someone. It can be multiple people, like you mentioned, and I think the key is that you learn something from someone and move on. So you get a bit of some good thing from someone, and then a bit of other good thing from some other person. So you accumulate the wealth. You accumulate the wealth of so many people altogether, which always admire, and feel a sense of gratitude for them, that you came across to them and they were in that situation, that they could guide you, and you can learn and move on in a direction which you were aiming to move on. So I think that's wonderful to having even more than, and it's quite interesting. Usually people say one two, but it's really brilliant to hear from you. So I think in at the end I would come to a question to which is very very generic, that we are talking about this session on technology, how we can change the strategies so that we can have a proper mechanism to deal with any emergency like COVID-19. And we are talking on this occasion of Motivational Monday, and I think it's very aptly word Motivational Monday on VH Network, which actually aiming to motivate people on the day one of the week starting. And I think so that's very very essential from you to take a couple of motivational thoughts. And so what do you think of the VOH broadcast like this Motivational Monday?
I think it's absolutely the most important thing, because while we've always known the importance of mental health, but in today's scenario, there cannot be anything more important than mental health. Mental health and resilience are like this, you know. So if you're not in a good place mentally, you cannot be resilient to be able to manage today. Forget about tomorrow. You won't be able to manage your life today, you know. So I
True.
think this is so important, and 90% of the time we know what we have, right? What we have to do.
True.
But when you hear it from somebody else, it reiterates and reaffirms what you think, and thereby gives you the strength of being able to handle it better. Because there's somebody, we are very bound by relationships, right?
True.
So so in our relationships, if our peer, very importantly, our peer also endorses your point of view, then you are far more strengthened to believe in yourself. And it is when you believe in yourself then you can create and you can make a new world.
I think that's really wonderful, and I wish we could continue going on in this, truly engaging discussion. And with you, especially, I can go on for days talking you and on different topics, not only the healthcare, but unfortunately, we have limitations, of the time, which is one of the most important factor in our life. So, thank you so much, Dr. Shabnam, for your wonderful, uh, illuminating, inspiring, thoughts, expressions, and views. It's really been a wonderful experience in last 30 minutes, I guess, with you. I'm sure the points and the discussions we have just had would definitely provoke positive thinking in the minds of our viewers today who are watching us at the moment. And they would definitely take some learnings for the betterment in their own life and career. So, ladies and gentlemen, my dear viewers of this Motivational Monday, we at VOH really appreciate your tuning in today for this very specific Motivational Monday with Dr. Shubnum Singh, who has been a pioneer in healthcare industry. We hope you have enjoyed today's episode, and we continue your support. Expect that you are our continuous listeners and viewers on VOH Network. Till the next, that's all from us. Goodbye. This is Dr. B.K. Rana, the host for today's Motivational Monday. Thank you very much, ladies and gentlemen. And once again, Dr. Shabnam, really appreciate your time and support for this Motivational Monday. It's really been an honor to host you for today. Thank you very much.
Thank you
Have a
so
nice day
much.
ahead. Thank you. Have a
Thank you. Thank you.